Welcome everyone. So in this video, I will try and simplify the various types of epidemiological studies. Okay, so in fact, there are two main types of epidemiological studies. Now, the two main types of epidemiological studies, we have experimental or interventional studies, and we have non-experimental or observational studies. Okay, so when we say experimental studies, it's the same as interventional studies. Now, usually, the experimental studies or interventional studies, we use them to test the effectiveness of programs, the effectiveness of interventions, or sometimes the effectiveness of a drug or a medicine or a vaccine. Okay, good. That's why we call it the experimental or interventional studies. Then we have the observational studies or the non-experimental studies. Okay, so the observational studies, we just use this kind of studies to observe people in their natural environment. Is that okay? But the experimental studies, usually we use it to test interventions. Okay, to test the effectiveness of an intervention in a controlled environment. Okay, so we have two main types of epidemiological studies. Now, when we say an experimental study, this is a type of epidemiological study where the epidemiologists or the investigators or the researchers, they try to manipulate two groups. So they manipulate what we call an exposure. So for example, we want to test a drug, we want to test an intervention, we want to test a medicine or a vaccine. Two groups are going to be created. One group will be given the medication, another group will not. Okay, then we study the two groups. Okay, so that then we draw some conclusions from the outcomes. Then we can now, based on that, to say that the medicine is effective or the medicine is not effective, or the intervention is effective or the intervention is not effective. So in experimental studies, researchers usually assign or manipulate exposures. For example, giving a drug. So they are going to manipulate two groups. One group will be given the new drug. Another group will be allowed to take probably the old or the already existing intervention. Then at the end of the day, they make comparison. Okay, such a study is what we call experimental study. Now, in observational study, researchers are not going to manipulate or assign any groups. People are not going to be put in any groups in observational study. The researchers are just going to observe people or observe a population for a particular event or a particular phenomena. Now, under the experimental or interventional studies, we can have two sub-classifications. The first one is called randomized control trial or clinical trial. And then the second one is called non-randomized control trial, or how do we call quasi-experimental, or you can call it field trial or community trial. Now, what is randomized control trial or clinical trial under experimental or interventional? Now, you remember I mentioned earlier that in experimental studies, two groups are usually going to be created, or researchers are going to manipulate exposures. Manipulate the exposures. So two groups are going to be created. Now, in randomized control trial, the two groups that are going to be created, the population or the group of people that were used to create the two groups, the members in that group, they were given equal chances of being part of the groups. Okay, chances were allowed. That is what we call randomization. Okay, so the population that were used to create, or the people that were used to create the two groups, the group that will be given the medication or the vaccine or the intervention, and the group that will not, or the group that will be allowed to take the already existing intervention of medication, chances will be allowed during the creation of those groups. Such a study is what we call randomized control trial. It's an experimental study, but because chances were allowed, we call it a randomized control trial. Now, we can do another experimental studies where we can just select people to form the groups using convenient approach. No randomization, chances will not be allowed. Such a study is called a non-randomized control trial. It's also an experimental, but it's a non-randomized control trial. What is making it non-randomized? Randomization. During the creation of the two groups, we didn't employ randomization. We didn't allow the members equal chance of being part of the control or experimental group. And there are times that in an experimental study, randomization is not feasible. For example, you want to do test and intervention in a larger population. Randomization may not be feasible. And that is why we also call it the field trial or community trial. Is that okay? We also call it the field trial or community trial. Okay, so we have experimental or interventional studies. Experimental studies can be randomized control or it can be non-randomized control. Okay, so over here you see in this diagram we have, did the researcher assign exposures? Were a group created? If yes, exposures were assigned, then it's an experimental study. If no exposures were assigned, no group was created, we don't have any people going to be exposed to something and another group going to be exposed to something different, such a study is just observational. Once exposures were not assigned, the study is an observational study. Okay, or you can call it non-experimental study. Now, with a non-experimental study, we can have two main types of non-experimental study. We can have the analytical study and then the descriptive study. We can have an analytical study and a descriptive study. What is a descriptive study? Now, if you want to do an observational study, but then that observational study, you just want to take, let's say, one person and just observe that person for patterns, for trends, for certain characteristics. That study, you are just observing one person, or maybe you take a particular population, you just want to observe them. Such a study, we call it a descriptive study. Now, for analytical study or analytic study, maybe you want to observe two people, let's say patient A, client A and client B, and make comparison. Let's say client A is having a particular disease like malaria. Client A is a male having malaria. Client B is a female having malaria. You want to observe client A, client B, and make comparison between the two clients regarding the same condition and try to draw conclusion by making comparison. Once you decide to make a comparison, now it's an analytical study. So analytical study is when analytical study can also be population based, where you take two different populations, let's say population A, population B, then you study them individually, then you now try to make comparison. It's also an analytical study, but this time population based. The same way we can have descriptive study where you pick an individual, then you study that individual. For example, such a study is what we call the case report. So you take one person, then you try to study that person for some time. Okay, it's a case report. It's an example of a descriptive study. We can have a case series where you take like 5 people, 6 people, case series, 6 people with the same condition. Then you study them to see trends, characteristics. You are not going to compare to another 5 different people. You are just studying the 5 people. Your intention is not to make comparison. Such a study we call it case series. It's a descriptive study. Is that okay? Then we can even have a study where you study a population. Let's say you take a population A, maybe there is an outbreak in a particular population. You take that population, then you study them. Your mindset is not to compare that population to another population. Such a study is called a health survey. It's also a descriptive study. Okay, your mindset is not to make a comparison. Now, the moment you decide to do an observational study, but then your mindset is to compare. So, for example, population A, there is an outbreak, there is a disease among population A. You want to study the whole of population A. Then there is the same outbreak among population B, maybe in a different geographical area. You want to study population B too and try to compare population A to population B in terms of the two diseases. Such a study, you are now doing an analytical study, but population based. The same way you can have 2 patients, maybe a male patient having a particular disease, a female patient having a particular disease. You study them individually, then decide to compare. That one too is an analytical study. What is making it analytical study? The fact that you are making a comparison. The moment you decide to make a comparison, that makes it an analytical study. Now, in descriptive study, you do not compare. You only use it to describe. Your focus is just to describe and understand patterns and understand trends. We can do a descriptive studies in population. You can do a descriptive studies in individuals or in just a small group. So if you are doing a descriptive study in an individual, that's what we call case report. Then we can have case series, let's say 5 or more people. Then we can have health survey, a population, a large population. Do you get it? That's a descriptive study. Now, the moment you decide to compare, let's say you are doing observational study, but your focus is that maybe you are studying patient A, patient B, then you compare them. The moment you bring in comparison, you are doing an analytical study. Now, in epidemiology, analytical study can further be divided into 3. Okay, we can have case control. Okay, usually with case control, you start from what makes it case control. Sometimes you can call it retrospective study. What makes it retrospective is that you pick someone who has an outcome, like a rare outcome, let's say a new disease, a strange disease that we know nothing about. Then we now want to study backward to go and look into the possible things or factors or determinants or the possible factors the person was exposed to. Okay, so that we can find associations. Such a study is called case control. So there is a new disease. Let's say 2 people are having it. You take those 2 people, then we study them backward and try and make comparison. Okay, 2 people are having this disease. Okay, let's study them backward. What was patient A exposed to? What was patient B exposed to? Okay, we want to know the exposures to go and understand the factors that possibly they were exposed to which contributed to the disease. So that at the end of the day, we will know the possible causes or factors associated with the disease. Such a study, so usually in case control, you start with what? Outcome. The present. The outcome is in the present. Then you study backward in time. Such a study is called a case control or retrospective study. Then we can have cross-sectional study. With a cross-sectional study, you are looking at the exposure and outcome at the same time. Okay, so you take 2 different people. Okay, you are looking at the outcome and exposure at the same time, at the present time. You are not looking at, in case control, you start with the outcome, then you look for the exposure into the past. You look into the past for the exposure. But in cross-sectional, you are looking at the outcome and then the exposure at the same time. Such a study is a cross-sectional study. Then you can have a cohort study, or what we call a follow-up study. Okay, sometimes you can also call it prospective study. Okay, good. Now with the cohort study, what happens is that you start with the exposure. So some people are exposed to certain risk factors. You can select all those people. Then you monitor them and see what will happen to them, the diseases they will develop, the outcomes they will develop in the future. So the cohort study starts from the exposure and monitor till an outcome is developed. Such a study is called a cohort study. But listen, we can have a cohort study, okay, that is retrospective, or we can have a follow-up study that is a cohort study that is retrospective. And that is also another subject on its own that we will discuss. Okay, so in summary, we have 2 main types of epidemiological studies. We have the experimental studies, and then we have the non-experimental or observational studies. Now, usually, one thing about the experimental studies is that experimental studies is very good if you want to establish cause to effect. And because experimental studies, randomization is allowed, it tries to reduce bias. But then experimental studies are very expensive, very time consuming. Sometimes ethical issues may arise because, you are going to test medications, you are going to test interventions. Sometimes you are using human beings. So ethical issues may be a challenge in experimental studies. Okay, and because experimental studies are done in a controlled environment, it may not represent the real world settings because it's not done in the people's natural environment, unlike observational studies where you observe people in their natural environment. Experimental studies, you do not observe people in their natural environment. Okay, it's done in a controlled setting, in a controlled environment. Okay, then we have the observational studies. Now, the advantage with observational studies is that it's very simple. It's very quick and less expensive as well. Okay, now another thing is that the disadvantage with observational studies is that it may not be that good to establish cause to effect relationship as compared to the experimental studies. And sometimes with observational studies, there can be reporting bias in observational studies. These are, some few disadvantages of observational studies. So in summary, we have two main types of epidemiological studies: experimental or interventional, and non-experimental or observational studies. Under experimental or interventional, we have the randomized control trial and non-randomized control trial. Now, randomized control trial, what does it mean? Now, in experimental studies, the researcher or the investigator assign exposures. Two groups are created. Now, in the creation of the two groups, that is what brings about the subtypes of experimental. So, if during the creation of the two groups, randomization was allowed, you allowed for randomization, meaning you gave the population, the members, equal chance of being part of either of the group. Such a study is called randomized control trial. Okay, now in a situation where you didn't allow for randomization, you use convenience, probably because randomization was not feasible. Sometimes you are dealing with a larger population. You are doing an interventional study in a larger community. Such a study, you can apply randomization. So you do a non-randomized. That's why we call it the field trial or community trial. Okay, then we have the observational studies. With observational studies, we have two forms: analytical study and descriptive. What makes it analytical? You are trying to make a comparison. So you are studying two people in their natural environment, but your mindset is you want to make comparison. So two people are having the same disease. You decide to study them. One is in a rural area, one is in an urban area. You decide to study them and make a comparison. Is that okay? Such a study is called an analytical study. So two people have developed the same disease. You decide to look back and then see what factors both of them they were exposed to. But then your mindset is you want to compare the two people. Such a study is an analytical study. It can be ahead. Maybe two people have been exposed. Two people are smoking. You want to study them ahead of time and then make comparison. Okay, that one, prospective study. That one too is analytical. Why? Because your mindset is that you want to make a comparison. Now, if you take the comparison factor from it, it becomes descriptive. You are studying two people, but you don't intend to draw any comparison. You are just observing them for trends, what will happen. Your mindset is not to compare them. That will now make it a descriptive study. Okay, so we have two forms of observational studies: descriptive and analytic. But the point is that the analytic can be population-based or individual-based. The same way descriptive can also be population-based or individual-based. So you can take a population, then you just want to study the population. Your mindset is not going to go to compare the population to another population, or you study a population for maybe a certain condition. Maybe there is an outbreak of a certain condition in the population. Your mindset is just to study. You don't intend to go and compare to another population. Such a study is a descriptive. But the moment you are studying, let's say, population A regarding a particular event, you are studying population B for that same event, but you want to compare them after the study. Such a study is an analytical study. Okay, so we have two forms of observational or non-experimental: the analytic and descriptive. Under the descriptive, you can have examples like case reports, case series, health survey, where you are looking at a whole population. You are just studying them for maybe, let's say, the prevalence of malaria. You are just studying them. Your focus is not to make comparison. Descriptive. Is that okay? But the moment you are studying to make comparison, analytic. Is that okay? Good. Under the analyticals, epidemiological studies, or observational studies, we can have what we call cross-sectional study or prevalence study. We can have case control study. We can have cohort study, or what we call follow-up study. Okay, so I think I'll end here with the types of epidemiological studies. In our next lesson, I would attempt to deal with the various types of analytical studies: the cross-sectional studies or the prevalence studies, the case control studies, or what we call the case reference studies, the cohort studies, or the follow-up studies. We look at the various subtypes of the analytical studies, their characteristics, their advantages, and then their disadvantages. See you in the next lesson. All the best. Bye-bye.